Hi, my name is Dr. Kevin Shaw from Newton Health and Wellness, and today Dave is going to be reviewing how he avoided rotator cuff surgery. I'd like to introduce Dave. Dave, what was it that brought you to the office first?
What brought me to the office was I had severe shoulder issues. I was involved in a car accident back in 2008. I had multiple surgeries on other parts of my body and my opposite shoulder. I was trying to avoid having shoulder surgery again. So I was having cortisone injections through an orthopedic surgeon, and he told me my last option was just to have surgery.
So you had surgery on your right shoulder.
On my right shoulder.
Difficult recovery.
Very difficult.
Hesitant to do it on your left shoulder.
Very hesitant.
Not really clear as to what a chiropractor could do for your shoulder. And then we discovered that your shoulder issues, your rotator cuff issues, were actually related to what?
So my shoulder issue turned out to be a neck issue, a nerve issue from my neck. When I came in, you did my x-rays, you went over this thorough exam, you wrote up a very thorough report for me and planned to review. I have to be very honest, like I've told you in the past, I was very skeptical. To me, you adjusting my neck and working on my neck with this table and adjustments just didn't correlate to me for repairing my shoulder, because I was at the point of not being able to sleep, living in constant pain, whether I was standing, sitting, walking.
Lots of limitations.
Lots of limitations, to the point where I wasn't even working out in the gym anymore because I couldn't bench press, I couldn't shoulder press, I couldn't do anything.
Affect your sleep?
I just didn't really sleep. I tossed and turned no matter where I placed pillows under my arm, over my arm, how I laid on my stomach, back, there was nothing for it. I tried taking, Advil and everything, nothing helped me, to the point where I was basically an insomniac. And going through this treatment, I have my life back. I can honestly have my life back, to the point where I'm even telling friends who have issues like this, take the time, just get the consultation, make it worth it.
So on Dave's examination, kind of revealed that the lower part of your neck, particularly on the left side, was affecting the nerves going into your arm, creating a lot of contracture in the muscles of the chest, creating limitations in the arm and in the shoulder, and very little range of motion also. You had a lot of limitation in range of motion, I remember early on. Just even bringing your arm up over your head was difficult for you.
I had to force myself to bring my arm over my head. I mean, I couldn't, if there was weight in it, I couldn't bring my arm up even to, this point here.
So what we recognized was that there was an irritated nerve in your neck, a couple of them, that influence and supply, nerve supply to the chest, to the shoulder, to the arm, and to the upper back. And you had a lot of muscle irritation, a lot of contracture. They said internal shoulder damage, but what we did was we took the pressure off the nerve by addressing the neck, the spine, by using this equipment, IDD therapy, which we'll let Dave explain a little bit about what his experience was with the IDD therapy and how you see it related to your condition.
So when I was originally, after my injuries were a result of a car accident from 2008 that I suffered, I had gone to physical therapy and they used a machine on my neck that kind of pumped air and stretched my neck out, which turns out that this is a much larger scale version of that. You explained it to me the first time I used it. I was a little nervous because it's like, kind of...
It's uncertain.
It's uncertain. It's a big machine. It's stretching you out and everything. But I laid in it. You set me up in it. And to be honest with you, I passed out in it. I went right to sleep.
Very comfortable.
Very comfortable. Very comfortable. And after a few sessions of it, every session I noticed more and more difference. I noticed more and more progress and much better feeling. So I look forward to the machine all the time.
So essentially, what the machine did for Dave was we were able to target specific discs in his neck, irritated nerves in the neck, and essentially the decompression is able to target those areas and kind of gently open them up and free the nerves and free the irritation. And that, coupled with therapy to your shoulder, we addressed the chest, a lot of the supportive muscles of the rotator cuff, adjusting your neck. We were able to see recovery with your shoulder. But did you see some recovery with some other things from the course of care that we defined for you?
Besides my shoulder, my sleep, my anxiety, my anxiousness, everything. My health. I used to get a lot of sinus infections. I was known for at least one a month. Even that, I haven't had a sinus infection.
You breathe more clearly.
Very clearly.
Yeah. It's because we put your head back on straight.
Yeah, you did.
You had good reasons to not have one on straight with the trauma that you sustained. You want to share a little bit about what it was that caused this injury?
So, yes, I'm a law enforcement officer. While on patrol, I was struck by a car tire and rim coming from the opposite direction, which I never saw coming at my vehicle. And it struck my windshield. Luckily, it caught most of the A-pillar of the windshield, but the windshield came in and hit me in the face. And as I pulled off the roadway to stop my vehicle, the vehicle behind me tried to pass on the shoulder going around the accident and rear-ended me at a high rate of speed. And through that, I was hit at such a force that I actually bent the two halves of my steering wheel inward towards my dashboard.
So intense trauma. So essentially, Dave's injuries were programmed years ago. You know, the reaction that he had, because he's in good condition, he was able to tolerate the injury, but a lot of the damages still existed. So what we had to do was essentially just unwork those things. Created a lot of muscle tensions, created some degenerative disc, and all we had to do was work these areas and restore some movement into those areas, and as a result of that, you were able to see recovery and probably consider yourself a bit more youthful now than you did prior to the treatment, I might think.
Absolutely. At 46 years old, I felt very limited. Even playing with my kids and everything else, coaching them and stuff. At work, being able to work out, I wasn't able to do those things because it wasn't worth the pain and the suffering. And I couldn't really use my left arm very much, so I kind of gave up physical weight lifting. And I would just try to substitute that with riding a bike or running outside because at least it would keep me in shape somewhat.
Right.
But yes, this has given me back my life. I know I tell you all the time,
Wow.
But it was just one thing that I always thought to myself, there's no way this man as a chiropractor can fix this issue for me.
Well, it's been my pleasure to witness it, and I appreciate you taking the time and sharing your story, because I think your story is a little extraordinary because of the nature of the injury that you sustained and the limitations that you were dealing with, and then your recovery as a result of it. And what I'd like to do is maybe follow up with another video where we actually explain a little bit more about the decompression and demonstrate how the decompression actually works while you're on the therapy.
If I may just add one
Sure.
last thing, Dr. Shaw, I am truly here to thank you from the bottom of my heart for giving me my life back. And I truly recommend you to everybody I can to take a path of least resistance. Don't have surgery right away. Go see Dr. Shaw and take the path of least resistance, and you'll have a whole much better quality of life, and you will not have the miserable recovery of surgery.
Well, I appreciate that. All right.
Thank you.